Purnima, and on occasion of Guru Purnima, I want to share with all of you something which is very important in your practice. So first of all, best wishes to all of you on the occasion of this Guru Purnima, and we'll learn one remedy which I used to use in my practice, specifically in case of females who suffers from the cancer of breast. I have used it many times. Nowadays, cancer cases, there are many cancer cases are getting referred to me, and generally when it is cancer of breast with ulcerative stage, when it is open cancer and ulcers are very painful, at that time Asteria Rubens never fails. This is a good remedy in such ulcerative stage of cancer of breast. Even before, prior to the ulcer, whenever the breast is very hard, indurated, very painful, Asteria Rubens is one of the important fish remedy and which is very helpful in such types of cases. You have seen in many cases I have used that. So, when we deal with the cancers, we have to understand the depth of the remedy. Asteria is one of such a remedy which covers the cancer miasm. So why not to learn it from Borix Mat Remedica and understand the depth of Asteria Rubens. So we'll learn what Borix says. Asteria Rubens is a red starfish. It is a remedy for the psychotic diathesis, a flabby lymphatic constitution, flabby with red face. So first sentence of Borix, I always suggest you that you read it carefully so that you can understand the better aspect of the remedy. The psychotic diathesis, so tendency towards the psychotic miasm. A hefty patient, a pot-bellied patient where the muscles are flabby, the constitution is strong, stout, and those who suffers with the affections of the glands, glandular affections, lymphatic affections. So this remedy has that typical diathesis. Lancinating pains which remains and disappears, nervous disturbances, neuralgias, chorea and hysteria come within the range of remedy. See, this is very important. Nervous disturbances. Nervous disturbances means related with the nerves, the things which are related with the nerves, on the tip of their nerves. So they get affected. They are of a nervous constitution. Nervous temperament, the chorea, affections of the nerves, involuntary movements of the organs. Hysteria, hysterical reactions, has been used for the cancer of breast and has an unquenched influence over the cancer disease. Excitement in both sexes. So cancer is the basic theme of the Asteria Rubens, and one should not forget about the Asteria Rubens, and specifically the breast cancer. Head cannot bear the contradiction, shocks in brains, throbbing, heat in head as if surrounded by hot air. So patient feels there is something around the head and he feels very hot around the head. That is typical of the Asteria Rubens. The face, the red pimples on sides of nose, chin, mouth, disposition to pimples in adolescence, that is one more feature of the Asteria Rubens. So hormonal imbalance is always there with the Asteria. Female, the colic and other suffering cease with appearance of the flow. Breast swell and pain in breast, specifically worse on left side. Just now we have treated one case of the CA breast with left-sided breast affections where ulceration is so much marked that ulceration was very offensive. So ulcerations with sharp pains, piercing to the scapula, pains down the left arm to the fingers, the worse by motion. So why there is pain around the whole left upper extremity? It is because the axillary involvement. So left breast affection where there is a cancer and with a metastasis to the left axillary glands, and because of pressure there is always pain in left upper extremity. Excitement of sexual instinct with nervous agitation, nodes and indurations of the mammary gland, dull and aching, neuralgic pains in this region, and this is very close to the conine. Both remedies have hard tumors, but in conine it is the hard indurated tumors but no ulcerative stage. In Asteria is very specifically even in ulcerative stage. Chest. The breasts are swollen, indurated. Neuralgia of the left breast and arm like bromium. Pain under the sternum and in the muscles of precordial region. So patient feels it is as if a pain from heart. Is it a pain from the breast? So they are in confusion. Left breast feels as if pulled inward. So that is a typical pure orange appearance of the breast which you can locate in which denotes the cancer, and that you can get with the asterias. And pain extends over the inner arm to the end of the little finger. So pain radiates from the inner arm from the axilla to the little finger, and that is typical where axillary involvement is there. One case I remember, it was nearly about 2003 when I was visiting the Nagar. There was one patient, and patient was having left breast tumor, and she was not diagnosed till that period, seen by number of gynecologists, and they explained that it is fibroadenoma. But when I seen that it was showing typical pure orange appearance, and I asked them immediately to go for investigation. So I asked them to go for investigation. They have done the biopsy, and in biopsy it was typical carcinoma of the breast which was diagnosed. Then I have started with the Asteria Rubens at the same time, but patient they were expecting operative. They have done the surgery, they have done the chemo, but what I have suggested, you continue with the remedy in order to remove the original disease. They have removed the tumor, they have removed or killed the cancer cells, but the original disease is not getting treated unless and until the dynamic disorder is treated. I have treated with her with Asteria Rubens, and after Asteria Rubens till today, it is nearly about 20 years now will happen. Patient is absolutely normal and she is doing very well. So it is a very good remedy in such types of cases. Left breast feels as if pulled inward and pain in hand and fingers of left side. The cancer of mammary even in ulcerative stage. And this is given in italics, that one should understand. Acute lancinating pains, axillary gland swollen, hard and knotted, and that indicates the metastasis to the axillary gland. So we must know the pathology. If you understand the pathology, we can reach to the remedy very fast. Nervous system, the gait is unsteady. Muscles refuse to obey the will. It is as good as the gelsemium, and that's why this has a nervous diathesis. Epilepsy preceded by twitching over whole body. So aura is over the whole body where the twitching starts, and patient knows that he or she will going to get the epilepsy. Stools, the constipation, ineffectual desire. Stools like olives, the diarrhea watery brown, gushing out in a jet. So gushing out diarrhea like crotontic, like phosphorus, this is very typical. Skin destitute of pliability and elasticity. So skin becomes roughed, the elasticity is lost. Itching spots, ulcers with fetir ichor, acne, psoriasis and herpes zoster, with worse on left arm and chest. So left-sidedness is more marked with this remedy. You can find it out with the breast, you can find it out with upper extremity, left upper extremity, even in skin disorder, you can get the same presentation. Enlarged axillary glands worse at night and in damp weather. So skin affections associated with the axillary gland affections. So it is a remedy not only for the left breast cancer, but it is also a remedy for herpes zoster or psoriasis, where you can get directly axillary gland affection. Relationship, it antidotes the plumbum as well as ginkgum metallicum. Compare conine maculatum, the carboanimalis, the carbovage, then arsenic, condirango. But this is not carbovage, it is carboanimalis, because all those remedies, conium, carboanimalis, condirango, they are the remedy for the breast cancers. They are the remedies for breast induration. Incompatible remedy along with Asteria, one should not go for Nux or coffee. Modalities, worse by coffee, worse by night, cold damp weather and left side. Dose, Boric mentioned 6 potency, but I will suggest that Asteria Rubens even in 30 or 200 you must have, and you can repeat Asteria Rubens in ulcerative stage of cancer. So this is a good remedy. One should not forget, specifically a psychotic remedy, but psychocancerous miasm is very important over there, and even in ulcerative stages of the breast cancer and herpes zoster and psoriasis, one should not forget Asteria Rubens. So thank you, and once again, a happy Guru Purnima to all of you.